Dan kita ada teman yang telah angkat tangan. Okey, Kenneth Wong. Kenneth Wong boleh pasangkan mikrofon anda, dipersilakan. Mungkin.
Hi, thank you, gentlemen. It was good to listen to you. Can I speak in English?
Yes, you can.
You are welcome.
Okay, all right. Yeah, I've got two questions. Basically, it's regarding area where you can and cannot blow. Is it correct to say blow the device, right? So one is, and you said metal would not be suitable for you to blow. If a person has done eye surgery and a lens is inserted inside the eye, would that kind of material be a problem with blowing on the eye or the face?
One more question.
Okay, the other question is, if a person has undergone hernia operation, I believe you know what is hernia operation, right? Okay, I think there's some sort of material inserted into the body. It could be plastic, I'm not sure. Can that area be blown over with Iteracare device? Okay, these are my two questions.
Mr. Sam, shall I answer?
Yeah, please, Mr. Soman.
Okay, all right. Mr. Kenneth Wong, huh?
Right, thanks.
So the first question is, you were asking about areas where can and cannot blow because of specific reasons.
Right.
Okay, now what we were trying to tell you was, people have different conditions on their body. So when they have different conditions, we do not know to what extent it can affect them. So as a general statement, the company says avoid these areas or these people with these problems because it may affect you. Now I give you an example. Let's say you have a stent in your heart. Okay, you have a stent in your heart. Now if I were to say don't use the blower, it's a general statement. We're saying okay, do not use. But you can probably use it on your legs. Okay, the legs is somewhere where you don't have a problem. The problem is at the heart. So avoid the heart. So I would look at it that way. Okay, coming back to the second question, hernia operation. Okay, now when the body is always trying to repair itself, but we are not giving the body what it requires. So because of that, it cannot do what it's supposed to do. And then at the same time, one of the treatments, allopathy treatment is, first thing is try to treat it with drugs. If not, then you get operated to solve that problem. And normally when you have already operated, it cannot go back to its original condition. Okay, that is number one. It's very difficult to go back to its original condition. We have to understand that it won't be the same as before. It's definitely going to be difficult. But we can bring it to as best as we can. And then the second one is, if in case there is something there inserted, so will that be affecting? So it's the same as what we have been telling. If there is some, what do you call that, outside material or whatsoever which is there, best is to avoid. Now, coming back to that, you are asking about the eyes. After an operation, the iris, you have inserted that lens there. So now the issue here is that lens, if you're just using terahertz energy, it really doesn't affect much. But then some people, they are not, what shall I say, careful. There are three speeds to the machine. One is fast, medium. Then you have slow in the middle with less heat. And then the last one is hot and fast. So if you use the wrong one on the eyes, then you have a problem. And then we don't want people to start blaming the company for this problem. So because of that, we avoid that problem, and the company tells you do not use it on these areas where you have this problem. But actually, if you see, for example, coming back to the eyes, if I were the one, what I will tell is, why not blow instead of blowing directly, blow it from the side? Because that terahertz waves are still going to go in. They're going to work on the eyes. But the thing is, the lens is a totally different thing. But what you might have, or the problem you might face is, now let's look at glasses. You don't talk about the lens on the iris. You have done a pair of glasses to a certain power that is correcting the problem in the eyes. Now, when you blow your eyes without the glasses, you're correcting the eyes. Now the eyes become better, Now these glasses here now are too strong for you, overpowered, because of the eyes becoming better. Similarly now, when you blow for your eyes, what if your eyes become better and that lens now is a bit too strong for it? Then you have another problem. So these are the things you might face. So generally, the company says avoid these areas to stay away from trouble. Does that answer you, Mr. Kenneth?
Yeah, partly. Can I continue because of what you have answered?
Okay.
Okay, I've got two more questions. One of it, would this terahertz energy damage the lens and therefore damage the eye? I'm talking about the lens that be inserted inside the cornea. And then the secondly, it is not just a matter of external object that is being put inside the body, I believe. It is a question of what kind of object, right? Right, so would that material for the eye or for the hernia, would that kind of material be damaged or be deformed because of terahertz, or is it because of some other reason why terahertz can't be applied directly on those areas?
Okay, coming back to the question, first the eyes, whether it will damage the lens or the eyes. The first thing is the eyes. So far, people have only improved after using. Of course, if you shouldn't use the heat, excess heat. Otherwise, the eyes will improve. As far as the lens is concerned, it's a very difficult thing to say because the quality of the lens from different people, the make of the lens. So we really do not know what can happen because even like plastic, let's say plastic, you go to certain shops, you buy the plastic, it's so thin that it breaks away. And then you can go to certain places, you have a plastic where it's stronger, lasts you longer. So similarly, the material which is used is important. So we just cannot say about the lens because we do not know what's the quality of the lens. Whereas the eyes, yes, you can see improvement. Now the second one is the objects which you are using, for example, in hernia, whether it will be damaged or deformed, similar. So you have different kinds of material which you use. And then with technological advances, you have better quality materials coming in. So which can probably withstand some heat. And then the changes will happen in that area. So it's a very difficult question to answer because we do not know what is the material used. So for that reason, to avoid complications, we tell you avoid those areas. So you're staying away from trouble. Mr. Kenneth?
Okay, it doesn't answer my question, but I will have to accept it then because you don't have an answer for it. It's okay.
We do not have an answer.
I will say the product sounds very good. I've already bought it actually. So I just trying to learn now and just trying to be careful because there are many people who have problems like this.
Yes.
And
be careful.
I've got the correction on the eye and on hernia using using surgery where materials are inserted into the body. Thank you. Thank you.
Yes. Be careful in those areas.